This video will show how to take a 7-site skin fold measurement. This determines the amount of subcutaneous fat that is proportional to the total amount of body fat. Before beginning the assessment, we want to make sure that your client is in shorts and if they feel comfortable without a shirt. This is the caliper that we'll be using. The right side is where you'll get your measurement of readings, and on the left side is where the skin fold will be clamped. A few things to keep in mind. When taking measurements, they will all be taken on the right side of the body. Be sure to pinch above the marked area, making sure to separate the subcutaneous fat from the muscle. Placing the caliper 1 centimeter away from the thumb and the index finger, making sure it's halfway between the fold and the crest, and maintaining the pinch during the reading. Take the reading within 1 to 2 seconds. We will be taking 3 measurements and using the mean of the 3. Be sure to rotate between the sites to allow the skin to return to its normal thickness and texture. 7 already marked sites: abdominal, suprailiac, thigh, chest, tricep, subscapular, and the mid-axillary. We'll be measuring the tricep, which is halfway between the acromion process and the olecranon process, posterior midline of the upper arm. Be sure the arm is held freely by the side of the body, and this is a vertical fold. Since this is a vertical fold, be sure that the caliper is faced vertically and is faced upwards with the numbers to where you can see it. To mark the chest area, for a female, it is 1/3 of the distance between the axillary line and the nipple. For men, it is 1.5 the distance between the axillary line and the nipple. And this is a diagonal fold. To mark the abdominal site, this will be 2 centimeters of the right of the umbilicus, which is your belly button, and it is a vertical fold. For the suprailiac site, you'll find the natural line of the iliac bone, or the client can point it out, and just go 2 centimeters superior of that and mark. This is a diagonal fold. For the thigh site, make sure the subject has all their weight on their left leg. The mark will be placed midway between the proximal border of the patella, which is the knee, and the inguinal crest, which is at the hip, and is anterior midline of the thigh. This will be a vertical fold. The next side is the subscapular. If you cannot locate the scapula, have them bring their arm behind their back and the scapula will be noticeable. This will be 1 to 2 centimeters below the inferior angle of the scapula, which is the point of the shoulder blade. Be sure to hold the caliper at a diagonal since this is a diagonal fold. For the mid-axillary mark, the mid-axillary line is at the level of the xiphoid process in the sternum. On females, it is usually where the sports bra band is. You may have to lift it a bit. Be sure to have your client place their arm in front of and across their chest to avoid them from stretching. If the arm is held up straight, they will be stretching, which will give you an error in the reading. This is a vertical fold. Remember, do not pinch the muscle nor the skin only, and it is important to retest if measurements are not within 1 to 2 millimeters from each other. The following shows 3 different equations. Depending on what sites you use, this will calculate the body density in men. These are the equations for body density for women. This also depends on the sites that you are willing to use. These are 2 different equations that can be used to calculate body fat percentage. For both, you will need the body density from the previous slides. The first one is the Brozicki equation, which is 457 divided by body density minus 414.2. For the Seaver equation for body fat, it is 495 divided by body density minus 450.